Good afternoon. Welcome to our January 12th, 2016 meeting of the Pitt County Department of Social Services Board. And in the absence, maybe temporary absence, of our chair, Melanie Bryant, I will be presiding. And I'd like to call this meeting to order. And let us begin by taking a moment to observe silent prayer or meditation. Amen.
Melanie is here.
Okay, I understand that nobody is here for public comment, Susan. So we will continue by asking for a motion to adopt.
I move the approval of the agenda as presented. If there's no addition, Madam Chairman.
And do I have a second for the adoption of the agenda?
I second.
All in favor? Aye. And now I need a motion to approve the
I move the approval of the minutes as mailed, Madam Chairman, if there are no corrections.
Do I have a second?
Second.
All in favor?
Aye.
Aye. Okay, we now will turn it back over to to Chairwoman Melanie Bryant.
And I'm sorry I was late. I got caught up in a meeting and tried to call your cell phone, and it went straight to voicemail.
Oh, we're glad you're here.
Next item on the agenda is our items for report, and we have a holiday cheer update. Joy Boykin, Tammy Corbett, not sure who's going to do it. I see Joy.
Tammy's
Oh, and Tammy's over here on this side of the pole.
Good afternoon. We had a very successful holiday cheer 2015, and I'd like to give you a little summary on that. All of our foster children, 138 foster children, received a visit from Santa on Christmas morning through the generous donations and the many sponsors that we had for the holiday cheer program. Gift cards or Santa bags were delivered for these children, and Pitt County DSS partnered with many of our other agencies and community resources to meet this endeavor to get this great accomplishment done. Our helpers included the Pitt County different companies and businesses, individual families and contributors, co-workers, area churches. And so I want to thank the community for the great success for the Holiday Cheer Project, for their generous and heartwarming contributions to from the citizens of Pitt County. It made a huge difference in the lives of these foster children this Christmas, and everyone, just every donation, all the calls, all the different people who contacted me, a great thank you for all that you did this year.
So as much as we want to thank the community and our supporters out there, thank you back to you and your staff too for where you had to shop and be Santa, shop and be Santa's elves and wrap presents, get them delivered, because it's definitely a community effort, not only the people in the community, but the community of our employees that work with the program as well.
And I want to thank all the foster care workers and the workers in the adoption placement unit. That everybody did a tremendous job, but it could not be done without the community support, and we
Absolutely.
do have a generous thank you for all that.
Anything from the board?
Just thank you, Joy, for your dedication, and you've really come around and taken hold of this ship, and we thank you because it's a huge project.
Thank you so much. Appreciate it.
Tammy, you want to do an update on the adult side?
The adults also had a very good year this year, and we would like to thank everyone for the tremendous response to our request to assist our wards and residents in adult care homes during the holiday season. And through the adoption of a resident, donation of items, and financial support, we were able to assist 135 residents in assisted living facilities during the Adult Foster Care Christmas Project. And because of the overwhelming response, every resident in need without financial means and with no family support was able to receive assistance and experience the joy of the season. So again, we thank everyone for their contribution and for helping this special population to experience happiness and the kindness that was shown to them throughout the holidays.
And to your staff who played Santa, played Rapper, did deliveries,
We had our reindeer ears on and we're out shopping and delivering.
They went out with reindeer antlers. They really did on the van.
That's good. We got a little Christmas cheer
That's right.
for the county employees as well.
We received reports, but we knew what it was.
We were waiting for Bless Your Heart.
Yes, we got permission first.
No, I'm only kidding.
Anything else from the board?
Thank you.
Thank you both very much.
Yes.
Okay, next item on the agenda is in keeping with having community partners come in and educate the board and let us know what's going on. We have Ronald Gaskins with Access East.
Okay.
How's everybody doing today?
Fun.
Great. Thank you for coming to speak with us
Thank you
today.
for having me. My name's Ron Gaskins, and I'm the executive director of Access East. And I had spoken with Jan about the opportunity to come today, and what I wanted to do was give you a brief overview of Access East, and then talk about a couple of specific areas that may be related to the work that we're collaborating with DSSs. Really, it's across the state, but certainly here in the East. So talk a little bit about foster kids and the program that we have going on with that. I just handed you some slides, and I'll just do a quick overview of Access East, and then talk a little bit more about our partnership with DSS. For those of you who don't know Access East, we're right here in Greenville, and we've been around 15 years. We're a 501c3, and we have a board. You can see the officers of the board right there, and we cover 27 counties. And what we do is we manage the Medicaid population for the state of North Carolina. And there's 14 networks. We're one of them across the state. And like I said, we're the biggest one geographically. And we try to wrap resources around Medicaid patients, high-risk Medicaid patients, to manage their health, keep them in low-cost settings, keep them in appropriate care settings so that they're not going to the ED unnecessarily and things of that nature. So that's in a nutshell. Access East has 5 main business lines, and on page 3, the Coastal Community Care Plan of Eastern Carolina, CCPC, that's our Medicaid business that I just mentioned. That's our biggest program. But we also manage Medicare patients, Upper Coastal Plain Transitional Care Program, as well as Health Assist. That's our uninsured program. We manage uninsured patients in Pitt and Greene County. And then we also have money around the Affordable Care Act, and that help folks navigate that. And we own the Jim Bernstein Center, the building. And I'll talk a little. I have a slide on that as well about what's happening out there in the Jim Bernstein Center. But all of our programs, whether it's Medicaid, Medicare, or uninsured, we all have the same mission, which is to improve the health status of the underserved and the indigent in Eastern North Carolina through enhancing access to quality health care. And we do that through coordinating with other partners in the community, one of them being DSS. On page, it's actually 4, I guess, is our organizational chart. I just wanted you to get an idea of how we're organized. As you can see, we have a lot of different programs, and it cuts across many different payers, but again, the mission is the same for all of these different programs that we have. And the next page is just our care management. We have a care management staff that we go out and manage the patients. It's pretty substantial, and these are all of the different districts that we have that are broken down in the 27 counties. The next graph is actually a map of the state of North Carolina, how all the different 14 networks are situated with Community Care of North Carolina. The east, you can see us out here, we're the blue section, 27 counties. If you go to the next, page 8, this is how our district is broken down. We have 5 different districts, and we have to decentralize our resources because we've got to spread it across 27 counties. So we have a team of care managers, pharmacists, pharm techs, social workers, RNs that are in each of these districts who manage the Medicaid population for us at a local level, boots on the ground. So this is how we've allocated our resources across the counties.
Could we ask you a question?
Sure.
All right, you have a budget of 18 million.
Yes, sir.
Where does this primarily come from?
We are funded for our Medicaid, we're funded by the state. The state has a contract with Community Care of North Carolina, and they contract with the 14 different networks, and we get a per member per month. So each Medicaid patient we have enrolled, which is 180,000 we have enrolled in our program, we get a set amount of money, and that funds everything we do on the Medicaid side.
I guess the reason I'm asking this, I go by the Bernstein Center out there about every day, 1 or 2 times mostly.
I'm sorry?
I go by that center about every day.
Okay.
You know, and some days there are all kinds of calls. Some days there are none. And I often wonder why. Well, it might be 3 or 4 days there's nobody there. How does it operate? I know Greene County is involved just like Pitt County is.
Are you talking about the Bernstein Center?
Yes.
Okay, you're
that.
talking about the gym.
Because you said we own that.
We own the building.
Yes.
We do. So the Bernstein Center out there, they have pediatrics, they have adult, they have a dental clinic out there, and Pitt County Community College is out there as well. They offer GED classes and ESL classes. They're accepting patients currently, and they have a provider base out there and patients who are coming day to day to see a provider.
I guess where I'm going to is this. I was told by a certain doctor they would like to have patients like me, you, to go there. I didn't know that. By doing that, they say they get more money. Is that correct?
Well,
By having the
the way
clientele
it works,
such as that.
that's a federally qualified health center.
Yeah,
So as an FQHC, which is the acronym for that, they get a certain level of reimbursement for Medicaid patients and Medicare patients. And they're sort of they're a safety net for the community.
yeah.
So they get a certain amount of reimbursement for Medicare patients, and that's how they generate revenue to run the clinic. Now, at the Bernstein Clinic, they have a lot of uninsured patients that go out there. So they try to have a good payer mix of
that's
Medicare and
what I was
Medicaid
told.
so they can generate revenue.
Mix 'em.
Right.
Yeah.
So that's how the FQHCs work.
Okay.
And it is ran by Greene County. We rent it out to Greene County for $1 a year, and they run that center. They also have FQHCs over in Greene County, Snow Hill, and KBR, and down in Pamlico. But we partner with them, and they run that for us and staff it. Does that answer your question?
It does. The average person, I'm afraid, I don't believe they understand what goes on out there. I really don't.
Well, it's a comprehensive clinic. It's got a lot going on.
This-
out
Oh,
there.
yeah.
It really does.
Well,
It's
I've
got
carried
great-
some out there, so I'm kind of familiar with it.
It's got great providers. They're accepting patients for both pediatrics and adults. The last time I
yeah.
heard they were. And like I said, Pitt Community College and a dental clinic. That they're actually in the process right now of adding 2 additional operatories, 2 additional bays for dental.
That I couldn't understand, and I asked one time, this has been a long time ago, do we have anybody from social service who is stationed out there?
Until December the 30th, we had someone stationed out there, but she retired. So we are in the process now of working with the facility to determine what they want to do. And my understanding is right now they want us to be on call as they need us, as opposed to having someone stationed out there full-time. We've got to negotiate a new contract as a result of that. But space, I think, is an issue. And since we are relatively close, that's the way they feel right now would be the best way to be served.
And I'm going to talk about our uninsured program, Health Assist, in just a second. And we have a care manager stationed at Bernstein Center who helps manage the uninsured population. I mentioned that as well to you. The next page is just a graph of the medical home. What we do for Medicaid patients is all about the medical home. We enroll providers to be a medical home. Patients are assigned to that practice, and we try to wrap care management resources around them, pharmacy and whatnot, to keep them in the medical home, good continuity of care, manage their chronic conditions, get them access to care. That's what we do for the population. And this is just an illustration. You've got an interdisciplinary team in the medical home. You've got data. We give the practices data on their patients so they can help manage them better. as well as stratify that population so they know who their high-risk patients are. Just a couple more slides about the Community Care Plan of Eastern Carolina. Like I said, we have around 175 to 180,000 patients. That fluctuates month to month. We have over 200 primary care providers in the East that are participating in our program, that are a medical home for Medicaid patients. And we have over 70 care managers. And in calendar year 2014, you can see our activity. We did a lot of home visits, a lot of phone calls, and a lot of medication reconciliations. That's what we do when we wrap resources around high-risk Medicaid patients. And we have indicators, one of them being foster kids, which I'll talk about on the next slide. But we're looking for who is impactable. So if we're going to send out a care manager, who's impactable? We really want to manage the population the best way we can and those that are receptive to our services. And like I said before, we have an interdisciplinary team approach. And this just talks a little bit more about our scope of work. We have staff that's embedded in different organizations to do this work, from hospitals to practices and whatnot. And we also do some QI work with the practices as well to help them better manage the population around clinical indicators. On page 12 is the Fostering Health NC program that is fairly recent, that we've been partnering with North Carolina Pediatric Society here in North Carolina, as well as DSS. That's on page 12, and I also handed out in your packet a handout around Fostering Health NC that I'll reference as we talk a little bit about the foster kids. But we know when we look at our Medicaid population and we look at the data, we know the foster kids are a high-risk population. They are coming from situations and environments where there could be substantial behavioral health issues, physical issues. They may get placed in different counties across the state and move around. So when we look at utilization, we look at the needs of this population, it's high risk. So this was sort of born out of that, on how can our program, Community Care Plan of Eastern Carolina, and our home office, which is in Raleigh, Community Care of North Carolina, how can we partner with state agencies, DSS, Pediatric Society, to better manage this population? What this handout here talks about are some best practices and what our role is. And what we've done is we have reached out to some DSSs here in the East, and we've, being that we get claims data, we get Medicaid claims data from the state, so we know where patients go, and that's how we manage the population. We identify the high risk. We've worked with the DSSs to try to give them access to something called Provider Portal, and that's a platform that you can log into and go see the utilization of a Medicaid patient for the last 15 months. Where have they gone for ED visits? Have they gone to the primary care doctor? Have they gone to a behavioral health specialty physician? What meds are they taking? Are they taking meds, and what's been prescribed? So you can pull up sort of a laundry list, 15-month snapshot of that patient. And we've provided access to some DSSs so they can access this information, because when a patient comes into foster care, there's got to be assessments that are done on that patient in a certain time frame. You've got to have an initial assessment. You've got to have a comprehensive assessment within 30 days. So we're trying to work with DSSs to manage the population, give them information so they can be better equipped to manage the population. Also, the practices that are seeing these patients are the same practices that are enrolled in our program. So we have care managers who are assigned to these practices. So we're working with the practices to try and make sure and work with the DSS staff that these kids are getting into the practices in a timely fashion and getting the assessments done in a timely fashion. And these are just best practices that they're trying to follow inside of this Fostering Health NC to better manage the population, facilitate information flow, which I talked about, the provider portal, make sure the frequency of the foster care visits, according to the American Academy of Pediatrics, is followed around well visits. And then these initial visits and comprehensive visits, the types of visits, how can we better collaborate around that? And we also, there's information on for physicians around billing and coding that this program is offering on how to best utilize and get the most out of seeing the patients and how you can bill and code them properly. And then we've also, there's been a lot of work around screening for social or emotional behavioral health issues for these kids as well, around PQR, ASQs and things of that nature. That's some best practices out there. And then oral health, obviously that's a big need of the Medicaid population as well. And then lastly, it's just transitions of care. A lot of times, a foster kid will be in one county and they get placed in 7 counties over or whatever it may be. So since we're statewide, we really try to make sure that that kid is enrolled in the community care program at that location. So they get a medical home, they get access to primary care, and there's a care manager assigned to them, working along with the DSS as well. So we really try to foster these transitions of care, whether they're moving to another county or maybe they just got admitted to the hospital and they're coming out, or they go to the ED or whatever it may be. So we really try to follow a lot of these best practices in working with the DSSs. This is fairly new. It's still getting going, but it's certainly an initiative that we're focused on, North Carolina Peace Society is focused on, and the DSSs are aware and focused on as well. Does that make sense?
I have a question, and I think this is for Jan more than anything. Not all of our foster children go through this, do they?
I think every foster child we've got is signed up for this. It's part of the process now.
How long has it been in existence like this?
About a year? About a
This
year
program?
feels
Yeah.
about right.
So if a child comes into foster care, all right, let's say that it comes in, do y'all still have voluntary agreements?
We don't do much in the way of voluntary
Okay,
agreements,
okay.
do we, Margaret? I haven't seen one since I've been here.
Okay, so it would be strictly legal. Okay. A child comes in and is getting ready to be placed into a foster home. Do y'all get notified when DSS gets a child, or does DSS initiate with y'all?
Well, the way that we've spoken in the past with Jan and her staff is we actually had her staff come over and we met with them. And we worked out a system where as they're taking on new patients, we're being alerted to that. We're sharing information. We have it's an agreement called a TECA that needed to be signed for the exchange of information. But we've set it up where we're talking with one another so that they can get access to the data, and then we can
It's almost like a part of your intake on the
Yeah.
DSS side now to know to contact you all for,
Right.
right, and we haven't done that with every county. We've got 27 counties, so we're just trying to work with counties that are receptive and want to participate.
And where would a child go to be initiated with y'all?
Well, whatever, and I don't understand, I don't know all the ins and outs of how it works within DSS. Jan?
Well, the primary provider, obviously, I mean, they're going to get to their primary
And
provider,
it could be somebody out in
depending
a...
on where they are, and then that sort of starts the whole process, too. I mean, and we can get Margaret up to talk more, too, but that's basically,
One
I
thing
mean,
that-
you go to the doctor, when we get the child, we work through the process with you guys, and
You don't have a certain doctor you're assigned to, do you?
we
Because
can
of
choose,
this.
we can choose the doctor.
And we
And
have
most of them, we go, if they're in town, we've got 2 or 3 doctors.
and what
we work
happens
with.
is when the patient is assigned to a practice that's enrolled with us,
That is enrolled with y'all.
enrolled with us
Okay.
for being a medical home, when that, see, historically, a lot of foster care kids were exempted from our program for years. There was an exempt code, and because they were moving around a lot and they were very transient. So there was a push a couple of years ago, I believe, really to enroll these kids in Carolina Access 2, which is our program, which is the medical home program. And they've done a really good job in getting, I think, most or all of the foster care kids now assigned to a practice and medical home, wherever they are at the time. And then what happens is they hit our data systems, and we know they're there at that point. And then we can reach out to DSS and we can start sharing information, making sure that whatever provider they're going to, they're getting in, they're getting these screenings. If they need behavioral health screening, maybe we can help facilitate that, work with the DSS staff who's responsible for doing these things and pushing it along.
But Ron, I do not understand.
Sounds wonderful.
I know you can't keep up with them. I deal with it. Informing, if you know what I'm talking. All right, if you go to Belvoir Elementary School, we'll say 50% of them are well, I would call them foreigners. I mean, I'm not downgrading anybody, so I don't think we want you to think that. But they just move in and out a lot. Well, they're chill. They're in the trailer parks and so forth. Who keeps up with all those kids outside the schools?
So,
I mean, you go out there, all you got to do is go out there and you'll see what I'm talking about.
Well, if I may jump in, if that's okay, you know, he only deals with the Medicaid population, and if they're enrolled in Medicaid, then they would have a medical home, and that's where Carolina Access would get involved
Right.
with them, okay? So, otherwise, he wouldn't have any
It
involvement
wouldn't have
in
anything to
that.
do with
No,
that.
sir.
Right.
Okay.
no, if
that's
they're
all.
not Medicaid,
No, they don't want you to have anything to do with them, by the way, too. Now. I mean, I'm not,
and we find a lot of Medicaid, they roll on and off Medicaid. One
Oh,
month
yeah.
they may have it, the next month they may, for whatever reason. But most, I think foster care kids is automatic for Medicaid. So if they're enrolled in a Carolina Access 2 practice that we've enrolled, we know they're there, and then we can reach out and partner with DSS to help make sure that the process is going through and them getting access to care, since we're already working with the physicians. So, and this program, like, is still fairly new, so there's still a lot of steps to flesh it out a little bit more and work out the kinks and all of that. But I think there was a big push because we're working with these providers, and these are our patients. We're enrolled in the program. We need to really facilitate that conversation with DSS to better smooth that transition when they come in and get care. Does that make sense? So that's our fostering care NC initiative that we have right now. And if I got just a couple more minutes, I'll just quickly finish this up. The next slide is just the Medicare transitions program we do around high-risk Medicare patients, which is very similar to what we do with the Medicaid population. And then I'll just mention Health Assist, because Health Assist is, we have a care coordinator at Bernstein Center, and they're working with the unenrolled, the uninsured, and we enroll them in this program, and they get a little card, and then they get access to reduced costs for specialty services. We get them into the primary care provider. We pay co-pays. We'll help with transportation. We have grant monies for endoscopies and colonoscopies and all these different things that we're trying to do, wrap resources and manage the population.
Would you mind just going back to page 13?
Sure.
I was just kind of skimming down the list, and it says scheduled to end in May.
Right. That Medicare program is. It was grant funded by the government, by CMS, Medicare, Medicaid.
All right, so this is your program that's going to be ending in May?
It's one of our program business lines.
One of your programs.
It's one of 5, and this one started 3 years ago, and it was always a 3-year project. The funding has ended. We're looking to sustain it and keep it going, and we're hopefully may partner with the hospitals to maintain it. But it's all around Medicare.
Okay.
Medicare. And you can see at the bottom of page 14 all the different things that we do around the uninsured population for Health Assist, and that does include the Bernstein Center. And then the next one is
Can I
just.
ask another question? I'm
Oh,
sorry.
I'm sorry.
Does this also include the, I know you're talking about the foster program. Does it graduate to what I'm thinking I understand as the guardian care program as well? The kids that age out, and they're in their, like, their 20s and above, and they're still on a guardianship
Right.
kind of.
I don't think
We-
this program's connected
We
to
have
that.
foster children who never maybe move into independence. They go right from being a foster child of the county to being an adult guardianship of the county. Maybe it's because of some mental health issue, that sort of thing. And that's what you're asking, is what kind of coverage do they have once they graduate out the foster care version? And
Yeah, and if they're Medicaid,
They still would have Medicaid if they qualify, and they would still be our patient, and we would still try to, if they're high risk, which they probably would be, and they're going to the ED or the hospital, we would reach out and wrap care management resources around them.
So even beyond that, like 18-year-old
Yes.
age, they're still covered through this program?
through their
Yeah.
through his adult services.
Through our Medicaid program. Fostering Health NC is for a certain amount of time for kids in foster
But if
care.
they graduate, and if they age out of foster care
Right.
that are still a Medicaid consumer.
We still would track them and manage them and work with them.
That's good to know.
Yeah, I mean, we have, I mean, from our population or age group goes from when kids are born, they get Medicaid, all the way up to those that are dual, have both Medicare and Medicaid. And that can be 60, 70, 80, whatever the, and you know, that's all our population, so we manage those.
It looks like to me you need to be working with Pitt Community College and getting these people, and when their dads say at the Belleville Elementary School and other, not only that one, but all of them, they need to get in a trade business immediately because we need,
Well, we do partner with them at the Bernstein Center.
well, that's where we need it.
you know,
I
they're
think that's
doing
something we need to
GED
get
classes and
involved more
things
and
like
more.
that.
So there'll be tax-paying citizens and so forth.
Right.
I really do. I think we are falling down on that.
Did I understand you to say a few minutes ago that, that you use Pitt Community College med students to help serve these clients as well? Is that
we-
part of their training?
Not at Bernstein Center.
Oh, okay.
No, they just offer classes out there at the Bernstein Center. the
Like
Pitt Community
GED
College.
classes?
Yes, and
Okay.
English as second
Yeah,
language,
they
things
need-
like that.
They need that too.
Yeah.
They need more of it, is what I think.
Now, there are some free clinics in town that med students will staff, like the
One in Grimesland.
Grimesland, now that's moved to the health
Yeah.
department, and Shelter Clinic and Oakmont. That's the 3 free clinics here in town.
Yeah.
And the last slide, and I won't go into this, is well, you see the Bernstein Center on page 16. I talked about that. And then just Medicaid reform coming up and what's going to be happening with that, which will impact what we do. And that's basically my slide presentation. Sorry, I probably took more time than I should
You're
have.
fine. You're
But
fine.
are there any other questions?
Now
Well,
we
I'm just so glad to have this information and to know that some of the people that you know, that we have compassion for, there are options out there for them, that they're not just out in the cold, but some people like you with the compassion you have to apply what's out there for their well-being. It's good to know.
And a lot of it's physical, but a lot of it's social. And that's why we have a team of social workers working with RNs. We want a hybrid model because a lot of times issues that when you look at medicating, you look at the utilization. Sometimes it's just the fact that someone may not have an AC in their house and it's 105 degrees outside, or a heater may not be on, or whatever it may be. That's driving them to the hospital or making them not feel well. So we really try to hit the social and the physical for this
And so
population.
then if your social worker saw something like that, do they know then to call us because we have low energy income
Yes.
programs?
They reach
and-
out to all the
and-
community
and
resources
summer
in that
fan
county.
programs and those
They do.
kind, so
They
you're
do.
connecting back.
That's the biggest thing we do is we really try to say, what do you need? And the patient many times can't navigate the system. So you need to go here. We make phone calls, we make referrals and do things like that.
It's
I have-
probably,
Go ahead, Becky.
it's probably in writing, but how many social workers do y'all have?
The majority of our staff are RNs. I think we have around 10 social workers or so that are care managers, and they're in each district. So we have a couple in each district, and we try to populate them there with the RNs, and they work together. A lot of times if we'll see a patient that has a majority diagnosis, primary diagnosis of behavioral health, the social worker will pick that patient up, and because they're more, many times, in tune with some of the issues that may be going on and the services that may be available for those patients. But we work together.
I've asked enough, but I'd like to ask you some more. I know you don't have time.
Well,
You don't have
we're located right behind the Starbucks at Stanton Square. You guys know where the Mexican restaurant is on the corner? And then there's I think it's a Chinese restaurant. We're Access East, we're right in there. It used to be the old Dollar General back there. You guys know what I'm talking about? We moved there a couple of years ago and renovated it. So that's where we are. So stop by. Or
I was gonna say, just
Jan's
give
got
us
my
your-
information.
That's really, give us your phone number and we'll just refer everybody straight to you.
Yeah, you guys can give me a
Well,
call.
I would really like to. It's really good for me to be able to go out and actually see these places and stuff. So I really would like to go out and visit if it's not an inconvenience.
I can give you my card.
Yeah.
All right. Anybody else want my card?
I mean, I don't want no part of them. I deal with them lots.
Call me anytime.
And I will sing praises. They've gotten lots of awards, new grant dollars. I mean, Ron's
give me
got a
one.
lot of
Give me
stuff
one.
going on.
I'm
So,
so impressed, I don't know what to do.
yeah, it's really cool what's going
That-
on. And they're getting ready
You
for
do
the
a good-
Medicaid
You
transition.
do a good job.
Thank
and
you. I appreciate that. Well, I appreciate everybody letting me come and
Thank you
present.
very,
And if you have
very
any
much.
questions, just give me a call or shoot me an email.
But it's wide open out there. They need a lot more help than what they're getting this treatment.
There's a lot of need, a lot of needs.
Lots.
Thank you.
Thank you.
Thank you very much. Next item on the agenda, Director's Report.
Okay. Well, first and foremost, Gwen has left for you the low-income energy assistance update, and I will run through that very quickly. As you remember, we had $899,750 available, and through January the 7th, you will see that we've spent over a fourth of that at $303,500, and we've already approved 1,302 households. So, and obviously, if the money lasts, we will be still continuing to take applications through the end of March. And the community partners are just doing a fabulous job, so, but that is an update on what's going on there.
Can we stop on that for just a second? When you send an approval letter to a household, it just says you have been approved for some amount of, provided we haven't run out of money? Or it says you have been approved for X amount? Which one?
It says you have been approved for X amount. It tells them exactly what they have been approved for.
And so the recipient gets that letter and we know we're not issuing a letter that we've run out of money, because as we issue those
Right.
letters, we start deducting it.
As we issue the letter, as the client is found eligible, the system counts down the money,
Okay.
client by client.
Okay.
So when we get down to the very last of our monies, we then start to tell people that you can apply, but we are down to the last of our funding, and we may not be able to honor it.
But they're not gonna get a letter that says they're eligible. They're gonna get a letter that says you've been deemed eligible for X amount of support.
Ye-
I
yes.
ask because I happen to be sitting in a municipal utility company over the holidays, and a lot of people had gotten their letters, and this particular municipal power agency was hesitant to take the letter as a commitment to pay, because they were under the impression that we were approving people without sort of encumbering the money.
We will not approve people unless we have the money.
And I told them
And the
that.
letter will state you are eligible for either $200, $300, or $400, based on your income and your household size.
But it will be in a specific amount.
It will be a specific amount
Right.
on each letter.
Okay, so the utility, and that letter is always going to be written to the utility. Does it say what utility you have agreed to pay for them? Does it say Greenville Utilities or Progress Energy or?
Yes, it does.
Okay,
And every applicant must provide their vendor and their account number,
okay.
so we can send it directly to where, so the county
Right.
sends it.
Well, I was
directly.
arguing that the municipal power agency should be able to take that letter and like link it to that customer's account and know that the money was on its way. And if it was the difference between shutting off that person or not, they know that there's this amount en route somewhere. And I think what, after talking to Jan, we discovered was the checks may have been written right at the point where the holiday break started, and they didn't necessarily go out in that afternoon's mail, and then the Christmas break came, so they really went out the following Monday. So there was a bigger gap between receipt of my approval letter and when the utility was getting the check.
There is always a gap,
This was a huge gap, like a 3-week gap.
right? And sometimes there in the past, there has been as much as a 3 to 4 week time period from when that person is approved until that check is received. That time has shortened now
Right,
somewhat.
well, and I can understand how the gap happens, but their letter had come to them on December 7th. And on December 27th, there was still no money received. And so they didn't understand why their letter could go in the mail, but their check to the vendor didn't go in the mail.
Right.
And so,
And that's a separate
and
process.
I
That's
do,
a separate-
that's what I explained. I said, letter comes from one place, check comes from another. They're not simultaneously, they don't, you may hold and write checks once a week, but I do think in this instance, the issue came up because of the holidays. But I want to go back to the municipal agency and say, no, they get a letter that says Melanie Bryan, $200 payable to, and that they can believe in the validity of it, because it's not that you've issued an authorization hoping that there'll still be money, but you are doing the declining balance thing.
Yes.
Okay. Thank you.
Can I ask a question about, like, the households that are denied? Are there usual, like, what are the majority of the reasons some of these people have been denied?
It's usually around their income, if they're over income. They are allowed a certain amount of income based on their household composition, and then they're allowed a certain amount of resources. If they have resources in excess of $2,500, then they would not be eligible. They would be over the income limit, and that is why most people are denied.
Okay, thank you.
Thank you. But I'm going to go back and tell them that I think they should ask to see a copy of the letter, because if they see if the power agency sees the letter and it says specifically $200 coming to Greenview Utilities or coming to Progress Energy, then they can take that as a commitment, as opposed to just Mary Smith has been approved, because it says Mary Smith has been approved for X amount to X power group.
Yes.
Thank you.
And we are not going to issue a letter if we do not have funding.
Well, see, and these were
To
phone
cover
calls
it.
coming in. The person didn't have the letter in front of them where we could see that it specifically said an amount, a payee, all of
Yes.
that. Thank you. So that'll be great.
Okay, the other things that you have in front of you are the vacancy report. A lot of these positions are in the process of being filled. Right now, we do have a significant number of vacancies. And you also see the financial report. Revenues are still running behind, and there are a couple of reasons for that, but that should be catching up shortly. Part of the issue, though, is the vacancies. We're not getting the 75% reimbursement, so, because we've got the position vacant. So it's all kind of coming together on that. So wanted you to have that. Couple things, just as other updates. The commissioners did approve the positions for the ABOD program. We have already started getting those job descriptions submitted for approval by the state. We are also in the process of getting the plan submitted to the state for approval. So hopefully I'll have something on that very shortly for you, but we are moving forward. There is a lot of interest. There have been articles in the Raleigh paper about what's going on with counties. There are a couple of TV stations trying to follow this, so everybody is very concerned about what's going to happen. I saw just before I came down here that there was an article recently written that said over 1 million people were going to be dropped off the food stamp program nationwide because of the implementation of these requirements. So there is significant interest in trying to provide the services so that folks can work towards employment and continue to receive food stamps while they make that transition. And we are already beginning, as of this month, talking to folks about what's happening as they come in for review or application, so that if they want to go ahead and be assisted with employment, we can go ahead and start moving them towards employment now and not wait till July 1 when the rules actually kick in. Now, we're not offering the extra services, but we are at least trying to connect them with our employment services resources that we do have. So we're moving in that direction already. Northwoods is moving right along. January 28th, we're going to start training on how to do case creation and scanning. The iPads are being configured now, so we can get those handed out, and so a lot is happening. It's like churning right now, a lot going on. So that's moving. The forms work is pretty much finished. We'll let you know that DSS is going to be featured on Pitt TV, probably starting Monday, on the YouTube channel. So if anybody wants to go check out what's going on, that's part of our attempt to get information out about our services and what we're doing. We did the recording today, in fact, so hopefully that'll be out there on Monday. So those are some of the things that are going on at DSS right now. Anybody?
Mr. Manager?
Is it possible to get an update regarding the SNAP program as released to Pitt County and the state of North Carolina? Is that anything you do on top of your head?
You mean as far as what the percentages are?
Yes, ma'am.
At the state level right now, the food and nutrition figures I saw last month on the weekly, statewide, it's about 90%. We still need to be at 95%. I have not seen the latest figures based on the QC, which is what the federal government actually uses. Pitt County has had good weeks and bad weeks, and part of it, of course, the holidays play into that, and but we are still running also 90 or above. What's causing us difficulty, and I think it's what's causing the state as a whole difficulty, is the expedited cases, where you pretty much have to issue those benefits on the day the person comes in order to meet the requirements. But we are trying to figure out why we continue to have a little bit of a problem with expedites, and I'm sure that's going on statewide. But yeah.
Deadline that the state had to meet?
They have to average 95% for the January through June period of time. But we actually started in what's going to count for that period in the 3 months prior to January 1. So we've been in that period for a little while.
Comments from the board?
I've got one I should have done before, but I didn't want to get it mixed up with the Christmas holiday cheer. And it just made me feel good to read in today's Daily Reflector. And of course, me being a retired teacher, I kind of glanced at the report card on the Daily Reflector. And in that was a picture of students who were working on creating blankets to give to children in foster care. It's called the Cuddly Companions Program, and it was started at G.R. Whitfield School. The teacher in Stephanie Perry's third grade class, give her recognition, read a book called Bud Not Buddy, and as a result of the book, they became compassionate for these foster kids' plight, and they decided they wanted to do something, and so the blankets became their effort. And then another high school teacher from South Central, Stephen Allen, does some sort of silk screening where he puts Cuddly Companions emblem on these blankets. And I think it's just a good reflection of the way, I was hoping Joy Boykin would still be here so that she could receive that credit for the welcoming, not just at Christmas, but through the year of things where we can partner with the community, and for children to understand the compassion that you never know when you're going to find yourself in that position.
That's right.
So I was just glad to see something happy and positive that our foster care could take part in.
That's perfect for bringing that forward, too. Anybody else?
If it's not, I move adjourn.
Just let it be known that the next meeting is February 9th before you motion to adjourn.
Huh?
I said,
Oh, yeah.
is there a second?
That was in my paper.
So moved.
That was in my paper.